First of all, it's my pleasure to be here. It's true, it's the first time I came to Belgrade, and it is really my pleasure and my honor to share all this beautiful information and the Congress with you and with the Serbian society. So congratulations for the Congress. It is really a beautiful Congress, and I was very impressed by the quality of the presentations and also by the impressive attendance during this Congress. So yes, I represent the European Association of Cardiovascular Imaging, and for this point I am also representing the European Society of Cardiology. And a few years ago we decided at the European Society of Cardiology level to merge three imaging techniques groups. That means echocardiography, CMR and nuclear techniques, nuclear and CT, to create the new EACVI group. That means the European Association of Cardiovascular Imaging. That means that all the imaging techniques are at the same level in this association, which is one of the most important and one of the largest associations of the European Society of Cardiology. It was a very important change, and I think it was also very important for young cardiologists, because you know that we are usually echocardiographists, but now more and more young cardiologists use not only echocardiography but also CMR and also nuclear techniques. So it is very important for them to have the possibility to be involved not only in an echo association but also in an imaging association. And I am particularly happy to see that you do the same we did at the European level. You are doing the same in Serbia, and this is my pleasure to be present here the year of your first Congress of Cardiology of Imaging, multi-modality imaging of the Serbian Society of Cardiology.
Thank you for that. And the second question would be regarding the infective endokarditis. We're here in Serbia facing, let's see, the increasing incidence of the more difficult forms of infective endokarditis. Since you are one of the leading authority in this field, can you comment about that? And of course, how is the best way to employ multimodality imaging for this specific disease?
Yes. It's a good point. I think infective endokarditis is a very interesting disease because it involved several specialties, infectious disease, radiology, cardiac surgeon, cardiologist of course, and specialist of internal medicine and of infectious disease. So it's really a disease in which we need to have several doctors in the same room to discuss the cases of patients. And it's true that the disease has changed. I would say that the number of new cases have not really changed, but the characteristics of patients is really different, because we have more and more old patients, elderly, more and more patients with toxicomany, or more and more patients with prosthetic valve and cardiac device related infective endokarditis. And we know that in this situation the diagnosis may be more difficult than in native endokarditis. So it is the reason why we need to have other imaging techniques. Echocardiography, of course, is the center of the diagnosis, and we perfectly know that the Duke criteria includes echocardiography as my major criterion for infective endokarditis. However, in some circumstances, we need other imaging techniques, and particularly in the field of prosthetic valve, we have recently shown that some nuclear techniques, for example PET-CT, may be able to make the diagnosis of prosthetic valve endokarditis earlier than echocardiography.
Professor Habib, can you please comment what is the best strategy for the cardiology in future? How to make the perfect cardiologists in future, and how to invest in them?
Yeah, this is a very important point, and my message should be for the young cardiologists, because you know that particularly in the field of imaging, cardiac imaging, and I'm talking about non-invasive cardiac imaging, more and more young cardiologists are invested, and probably more than it was in the past years. If I take the example of the European Society of Cardiovascular Imaging, the young cardiologists are young imagers and represent now about half of all our imaging community at the European level. So the message for me and for young cardiologists in Serbia is to do the same. That means to look at echocardiography first, of course, because it is what they do every day, but also to learn other imaging techniques, because the future is in the field of multimodality imaging. And also, if I have something to say to young cardiologists in Serbia, is to work with you, with your team and with our imaging association, and also to come in our association, the European Society of Cardiology and the European Association of Cardiovascular Imaging, because there is a big young group of people. The name is Club 35, but it will probably change in the next year. And that means that this is very important, because there is between these young imagers a link across Europe and also across all the world between the young. And I think it's really very important for them.
Thank you very much.
Thank you.